the patients with psoriasis, of course, they're very self-conscious, so it takes a huge toll on their romantic relationships and intimate relationships, and it also takes a toll on their professional relationships. So we have to identify it. The first thing, of course, is to treat the disease itself. There are many drugs available now, thankfully. So the dermatologist's armamentarium is ever expanding as far as psoriasis is concerned. Even many psychiatric drugs, antipsychotics and SSRIs, many drugs can cause a flare in a psoriasis. So we should be very familiar with psychiatric medications, and we should also be familiar with our dermatology medications that can potentially worsen psoriasis. And of course, a multidisciplinary approach is needed. If at any point in time you feel like the patient has a serious comorbid psychiatric illness, they need the help of a professional, please do not hesitate to refer them to a psychiatrist. Explain to the patient that there is no shame or stigma in suffering from depression or suffering from any mental health illness for that matter. Then it's perfectly normal that someone with psoriasis also has coexisting, mental health issues. Explain it to them. Then make sure that they have help available when they need it.
Hi, I'm Dr. Santoshi.
Can people with psoriasis live a normal, healthy life? Yes, they can. I did mention that psoriasis is an independent cardiovascular risk factor. So when a patient with psoriasis walks into the OPD, we should consider all these factors. We should also ask questions about coexisting hypertension, coexisting diabetes, coexisting hypothyroidism, coexisting dyslipidemia, and if present, any and all of these factors have to be addressed independently in a very efficient manner, because as much as possible we have to give a holistic care to our patient. And we should also actively seek out mental health issues that are comorbid or which are caused by the psoriasis, because the patients with psoriasis, of course, they're very self-conscious, so it takes a huge toll on their romantic relationships and intimate relationships, and it also takes a toll on their professional relationships. So we have to identify it. The first thing, of course, is to treat the disease itself. There are many drugs available now, thankfully. So the dermatologist's armamentarium is ever expanding as far as psoriasis is concerned. So as doctors, we can, keep ourselves up to date as to what is the best possible treatment that we can give to a particular patient, taking into account their, their social and economic status, the feasibility and the affordability, and pertaining to the kind of psoriasis, if there is any coexisting psoriatic arthritis or any of these factors, right? We should also be aware of the drugs that can flare psoriasis, because these patients also have many of them have coexisting hypertension, coexisting dyslipidemia and beta blockers, many antihypertensives. Many drugs are known to cause a flare in psoriasis. Even many psychiatric drugs, antipsychotics and SSRIs, many drugs can cause a flare in a psoriasis. So we should be very familiar with psychiatric medications, and we should also be familiar with our dermatology medications that can potentially worsen psoriasis, and that's the first step. And second thing is, encourage the patient to take treatment properly. Many of them give up hope. They say, I've been using this for many years and nothing's happening. Should I use this for the rest of my life? Tell the patient, yes, it is a lifelong thing. It can be kept under control, but there is no cure. Once the patient accepts it, comes to accept that this is the nature of their illness, they will deal with it better. They'll be more compliant with the treatment. And once the disease goes into remission, obviously the patient and you as a professional also happy. Okay. That said, low self-esteem is of course part of many skin diseases, right? That's why they come to us in the first place. Many of the skin diseases are not life-threatening, but they still come to the dermatologist as the first indication that there is a skin disease, because it takes a toll on their self-esteem. And psoriasis is nothing new. Anyone with psoriasis will be very conscious of the state of their skin. First of all, people have to be made aware, themselves as well as their family, they have to be made aware that it's not contagious. They should be treated like any other individual, okay? If needed, social media campaigns can be held to reduce the stigma associated with psoriasis, because many people are unfortunately unaware that it's not contagious, it's not going to spread from one person to the other. So these people have to be treated with like any other individual, okay? So that itself will go a long way, and we as practitioners, we can just give the best possible treatment to our patients to reduce the disease severity, while also addressing the psychosocial impact of the disease. Once the patient feels heard, they feel good. They feel like can trust you. If there's any other underlying issues, they will open up to you as well. And of course, a multidisciplinary approach is needed. If at any point in time you feel like the patient has a serious comorbid psychiatric illness, they need the help of a professional, please do not hesitate to refer them to a psychiatrist. Explain to the patient that there is no shame or stigma in suffering from depression or suffering from any mental health illness for that matter. Then it's perfectly normal that someone with psoriasis also has coexisting, mental health issues. Explain it to them. Then make sure that they have help available when they need it, be it in the form of a therapist or a psychiatrist, or for that matter, anybody. And of course, a healthy lifestyle is important for any skin disease, especially so for psoriasis. Okay, keeping their BMI in the ideal range, and consuming the right kind of diet, 8 hours of sleep, and of course mental health focused activities like mindfulness, relaxation, yoga. Any of these things can have to be incorporated actively before the patient is suffering from any kind of mental illness. There have to be preventive measures in place so that the patient doesn't have to suffer in the first place.